Imagine ignoring a subtle sign from your body that could be the difference between life and death. What if that small symptom you brushed off, something as simple as a persistent cough or a slight change in your skin, was actually your body's way of warning you about cancer? Early detection is key, and today we're diving into 8 early warning signs of cancer that you must know. These signs might save your life. Before we deep dive into the video, please subscribe to our channel for more informative videos. Now back to the topic. 1. Dysphagia, difficulty swallowing. Dysphagia or difficulty swallowing is a symptom many of us may dismiss as something temporary, perhaps caused by a cold or something stuck in our throat. However, when this sensation lingers or worsens, it could be a sign of a serious underlying condition, including cancer. This early warning signal often occurs when a tumor develops in the throat, esophagus, or surrounding areas. For many individuals, the first noticeable symptom of dysphagia is a persistent feeling of food getting stuck in the throat or chest. It may be accompanied by pain when swallowing or a sensation that something is blocking the airways. This can make eating and drinking difficult and uncomfortable. You might start to avoid certain foods because of the difficulty or pain associated with swallowing, but the issue is deeper than a simple discomfort. It's your body signaling that something is wrong. Dysphagia can be caused by cancers that affect the esophagus, throat, or even the surrounding structures, such as the lymph nodes. As tumors grow in these areas, they can obstruct the passage of food and liquids, leading to this distressing symptom. Early detection of the cause of dysphagia is crucial because cancers found in these regions are often treatable when caught in their early stages. Ignoring this symptom or attributing it to benign causes could delay diagnosis, making treatment more difficult. If you experience dysphagia that doesn't improve or worsens over time, seeking medical attention is essential. A doctor may perform tests like an endoscopy, a barium swallow, or imaging scans to determine the cause and provide timely intervention. Early treatment, particularly for cancers affecting the throat and esophagus, can significantly improve outcomes and save lives. 2. Hoarseness, change in voice. Hoarseness is a common issue that many of us encounter at some point, often due to a cold, flu, or excessive use of the voice. However, when a change in voice quality persists for more than 2 weeks, it becomes a signal you should not ignore. In fact, chronic hoarseness can be an early warning sign of certain types of cancers, particularly those affecting the vocal cords, larynx, or surrounding areas. The voice box, or larynx, is a delicate structure that controls how we produce sound. It contains vocal cords that vibrate as air passes through them, shaping the sounds we make when speaking. When something disrupts this process, such as a tumor or growth on the vocal cords, it can result in hoarseness. This change may start as a mild raspy or strained voice and can worsen over time, leading to difficulty speaking or loss of voice altogether. In addition to hoarseness, you may experience a dry cough, a feeling of something stuck in your throat, or discomfort when speaking. While hoarseness can be caused by non-cancerous conditions like laryngitis or acid reflux, persistent hoarseness that doesn't resolve with typical treatments or lasts for weeks should prompt a visit to a healthcare provider. It is particularly concerning if the hoarseness is accompanied by other symptoms like difficulty swallowing or unexplained weight loss. Cancer of the larynx, thyroid, or other nearby structures can interfere with vocal cord function, leading to hoarseness. Early detection through physical examination, imaging studies, or a laryngoscopy can help identify the underlying cause. The sooner cancer is detected in these areas, the better the chances of successful treatment. If you've noticed your voice becoming persistently hoarse without a clear cause, don't wait for it to resolve on its own. Seek medical advice early. It might just save your life. 3. Breast mass, lump in the breast. Finding a lump or mass in the breast can be one of the most alarming experiences for anyone. However, It's important to understand that not all lumps are cancerous. That said, any new lump or change in the breast should be evaluated by a healthcare professional, as it can sometimes be an early sign of breast cancer. Detecting a breast mass early significantly increases the chances of successful treatment. A breast mass is typically a firm, painless lump that may feel different from the surrounding tissue. It may appear on one or both breasts, and its size can vary. While most breast masses are benign, some can be malignant, meaning they may indicate the presence of cancer. These masses may be felt during a routine self-exam or noticed during a mammogram or ultrasound. The key factor in identifying a potentially dangerous mass is its characteristics: hard, irregular edges, immobility, and a change in the skin or nipple. In addition to the lump, other signs that may accompany a breast mass include unexplained pain, skin changes like redness or puckering, or discharge from the nipple that is not related to breastfeeding. If any of these symptoms occur, it is crucial to seek immediate medical attention. Mammograms, ultrasounds, and biopsies are common methods for diagnosing breast cancer. If a lump is found to be cancerous, early detection plays a vital role in the treatment options available. In many cases, breast cancer is treatable if caught in its early stages, with treatments such as surgery, chemotherapy, and radiation offering excellent results. If you detect a lump in your breast, don't panic, but do not ignore it either. Scheduling a medical appointment to have it examined as soon as possible can be the key to catching any potential issues early and ensuring the best possible outcome. 4. Fever, unexplained or persistent fever. A fever is often one of the body's first responses to an infection, and in many cases, it is a sign that your immune system is fighting off something harmful. However, when a fever is persistent or unexplained, it can sometimes point to something more serious, including cancer. An ongoing low-grade fever that doesn't seem to resolve, particularly without a clear cause, is one of the early signs that you should take seriously. Fever occurs when the body's temperature regulation system becomes disrupted due to an infection, inflammation, or other underlying conditions. In the case of cancer, a persistent fever may be the result of the body's immune response to the growth of cancerous cells. Some cancers, like lymphoma or leukemia, are particularly associated with this kind of unexplained fever. In fact, a fever may be one of the earliest symptoms of these types of blood cancers, even before other obvious signs appear. In addition to fever, you may notice other accompanying symptoms such as night sweats, unexplained weight loss, or fatigue. If these symptoms are persistent or gradually worsen, they could indicate that your body is dealing with something more serious than just a common illness. While fevers are more commonly associated with infections like the flu or cold, the fever caused by cancer is usually persistent and may come with other telltale signs such as pain, weakness, or unexplained swelling. If you experience a fever lasting more than a week, especially when there is no obvious cause, it's important to consult with a healthcare provider to rule out any serious conditions, including cancer. Early detection and diagnosis can help manage symptoms, address underlying causes, and improve treatment options. Ignoring a fever that persists without explanation can delay the diagnosis of serious conditions, potentially making treatment more difficult. 5. Abdominal pain, persistent or unexplained pain. Abdominal pain is one of the most common complaints people experience, and it can result from a wide range of causes, from indigestion to stress. However, when abdominal pain becomes persistent, severe, or unexplained, it may signal a more serious condition, such as cancer. Abdominal pain, especially when accompanied by other warning signs, can sometimes be an early indication of cancers affecting the digestive system, including the stomach, liver, pancreas, or colon. Cancer in the abdominal area can cause pain by either growing into surrounding organs, blocking digestive pathways, or causing internal bleeding. This pain often starts as a dull ache or discomfort and can gradually worsen, becoming sharp or cramp-like. The pain may come and go, Or it could become constant, and it may be located in specific areas of the abdomen, such as the upper right, which could point to liver cancer, or the lower abdomen, suggesting colon cancer. In some cases, the pain might be associated with bloating, nausea, or changes in bowel movement. In addition to the pain itself, other signs that might accompany abdominal pain and should raise concern include unexplained weight loss, loss of appetite, or blood in the stool. If you're experiencing persistent abdominal discomfort or cramping, it's important not to dismiss it as just a temporary issue. Particularly if the pain doesn't improve after a few days, a visit to a healthcare provider is essential. The healthcare provider may recommend imaging tests such as ultrasound, CT scans, or endoscopy to evaluate the organs within the abdomen and identify any abnormalities. Early detection of abdominal cancers significantly improves the chance for successful treatment, as cancers in the stomach, pancreas, or liver are often more difficult to treat once they have spread. If you've been dealing with persistent abdominal pain, especially when combined with other warning signs, don't wait. Seek medical help to get to the root of the problem and ensure prompt treatment. 6. Excessive bruising, unexplained bruises. Bruising is a common occurrence, often the result of bumping into something or a minor injury. However, when bruises appear without any clear cause, or when they seem unusually large or persistent, it may be a sign of something more serious, including cancer. Excessive or unexplained bruising can indicate problems with blood clotting or the functioning of the platelets in your blood, both of which can be linked to certain types of cancer such as leukemia or other blood cancers. In a healthy body, when blood vessels are injured, platelets rush to the site to help clot the blood and stop the bleeding. However, when cancer affects the bone marrow or the blood, it can interfere with this process. Leukemia, for example, is a type of blood cancer that impacts the production of blood cells, including platelets. When platelet production is disrupted, it can result in easy or excessive bruising, even from the slightest touch. These bruises may appear more prominently on the legs, arms, or other areas where blood vessels are close to the surface of the skin. In addition to unexplained bruising, you may notice other symptoms such as excessive bleeding from small cuts, nosebleeds, or prolonged bleeding from minor injuries. These signs could indicate that your body is not able to properly control bleeding due to a low platelet count, which is often seen in blood cancers. If you notice that you are bruising easily or for no apparent reason, it's important to consult with a healthcare provider right away. Blood tests, including a complete blood count, CBC, can help determine whether there is a problem with platelet production or other issues related to your blood cells. Early detection of blood cancers or other underlying conditions can make a significant difference in treatment outcomes, improving the chances for a full recovery. While most bruises are not caused by cancer, it's crucial not to ignore unexplained or persistent bruising. Catching it early may help identify the cause before it progresses to something more serious. 7. Melanocytic nevus, changes in moles or skin lesions. Most of us have moles or beauty marks, and in most cases, they are harmless. However, any noticeable changes in the appearance of a mole or skin lesion should raise concern. The development of new moles or changes in existing moles could be a warning sign of skin cancer, particularly melanoma. Melanocytic nevi, the medical term for moles, are typically benign, but when they start to look different, larger, asymmetrical, irregular in shape, or multicolored, it can indicate that the mole has turned cancerous. Melanoma, the deadliest form of skin cancer, often begins in the melanocytes, the cells that produce pigment in the skin. When a mole or spot begins to change in appearance, it may signal that cancerous cells are developing within it. The classic signs to look for are the ABEDE of melanoma: asymmetry, irregular borders, multiple colors, diameter greater than 6 millimeters, and any change in elevation or texture of the mole. Aside from these physical changes, A melanoma might itch, bleed, or become painful. If you notice a mole that seems to be growing rapidly, it is essential to seek immediate medical advice. Even if the mole doesn't seem painful or cause discomfort, these changes should not be ignored. A dermatologist can perform a thorough examination of your skin and may take a biopsy of the mole to check for cancerous cells. If melanoma is caught early, the chances of successful treatment are much higher. In fact, early detection and removal of melanoma can save lives, as the cancer tends to spread quickly if left untreated. While most moles are harmless, it's vital to monitor your skin regularly for any changes. If you spot anything unusual, or if a mole begins to change, don't wait. Early intervention is the key to effective treatment and better outcomes. 8. Blood in the urine or stool. Hematuria or rectal bleeding. Finding blood in your urine or stool can be an alarming experience. While it's easy to attribute these occurrences to something minor, such as hemorrhoids or urinary tract infections, they can also be early warning signs of serious conditions, including cancer. Blood in the urine, hematuria or stool, rectal bleeding should never be ignored, as it could indicate the presence of cancers affecting the urinary tract, colon or rectum. Hematuria, or blood in the urine, can appear as pink, red, or brown-colored urine, or you might see blood in the toilet after urinating. The presence of blood in the urine could be caused by several conditions, such as bladder or kidney cancer. Tumors in the urinary tract can cause bleeding, which may not always be accompanied by pain. The presence of blood, even without other symptoms, should prompt a visit to the doctor for further investigation. Similarly, blood in the stool may be bright red or dark, resembling tar. This could indicate rectal or colon cancer, although it may also be a sign of hemorrhoids, ulcers, or other digestive conditions. When the blood appears to be mixed with stool, or if it is dark and tarry, it may be indicative of internal bleeding from higher in the digestive tract, which is often associated with colon cancer. Blood that is bright red, on the other hand, may come from lower in the gastrointestinal tract, such as the rectum. Along with blood, other warning signs, such as changes in bowel habits, like diarrhea, constipation, or narrowing of stools, unexplained weight loss, or persistent abdominal discomfort, should also prompt immediate medical attention. If you notice blood in your urine or stool, don't wait for it to go away on its own. Early diagnosis through tests such as colonoscopies, CT scans, or cystoscopies can help detect any underlying issues, including cancers of the colon, rectum, or urinary tract. Catching these types of cancer early can make all the difference in treatment success and survival rates. Even if you suspect a benign cause, it is always better to get checked out by a healthcare provider. Early intervention can lead to more effective treatments, better outcomes, and, in many cases, life-saving results. Remember, your health is in your hands. If you notice any of these warning signs, don't wait for them to get worse. Schedule a checkup and take control of your health today. Early detection can make all the difference, so don't hesitate to seek help. If you found this video helpful, don't forget to share it with loved ones. Stay informed, stay proactive, and together, we can beat cancer with awareness and action. For more tips on staying healthy, make sure to subscribe and hit the notification bell. Thanks for watching.